is winning the race. It's fast and it's strong. It's faster than we are, it's stronger than we are, and we're not going to catch it unless everybody is a team together.
It's known as COVID-19.
Take this virus seriously.
And it's crippling our country.
This is going to be our Pearl Harbor moment, our 9/11 moment, only it's not going to be localized.
More than 1.5 million people infected across more than 200 countries. 90,000 have died.
There's no question we have to do more.
Here at home.
Our preacher is going to marry us on a Zoom call.
We're going to do drive-in worship service.
I'm announcing today that the remainder of this school year is going to be closed.
A focused approach.
There's a lot of things that go into when that peak could occur, such as whether or not we adhere to social distancing.
In this time of crisis and confusion about COVID-19, Arkansas Governor Asa Hutchinson sits down to answer your questions. A virtual town hall to help calm fears and ease concerns. Now, live with Governor Asa Hutchinson.
Good evening and thank you for joining us tonight. I'm Bob Clausen.
I'm Donna Terrell. As of tonight, it has been 100 days since the first case of COVID-19 in Wuhan, China was reported to the World Health Organization.
I want to go ahead and give you some perspective on this and how it's spread. That first blue dot you see there in China quickly, then smaller dots start to spread across the world. A little over 3 months later, you can see it is literally everywhere in all of our lives.
It's amazing when you see it from that perspective. It's what brings us here tonight. This is your chance to get answers to all of your questions about how this is affecting our health, our economies, our schools, and of course, we want to know what's next.
And we want to welcome our guest this evening. Governor Asa Hutchinson is here with the #1 doctor in the state, Dr. Nate Smith, Director and State Health Officer for the Department of Health. Gentlemen, thank you very much for being here. We understand that your time is very valuable, but you've taken at least a little sliver of it out tonight to talk to all Arkansans.
And when we say that, we do mean all Arkansans, because this virtual town hall is being broadcast in Fayetteville, Springfield, Jonesboro, Memphis, Monroe, Shreveport, and of course in Little Rock. That's 8 television stations across the state. And it's also available online to every news website in our state of Arkansas.
That's right. And at last check, we have had more than 300 questions submitted by viewers. You can submit your questions right now on our website. Just search Ask Asa. On social media, use the hashtag AskAsa. We're going to get to as many of those questions as we possibly can with the next hour. Donna, we have a lot of them.
Those questions came in fast and furious. Well, now we want you at home to know that we are following the CDC's guidelines, because we don't want to put any of us in danger. Everyone in the building, including the governor and his team, had their temperature checked tonight from a nurse from Baptist Health. No one in our building has a fever tonight. And there are less than 10 people in the studio. That includes Bob and me. Also, it probably doesn't look like it as you watch us here on the screen, but we are 6 feet or more apart. So we are following the rules that have been set by the state.
Distancing. First things first, Governor Hutchinson, you've made this available time to the public. Certainly, again, appreciate you for that. Want to give you the opportunity to take the floor and share with the public, share with folks in Arkansas, how we're doing, how we've been doing, and maybe even arc into the future. How are we going to be doing?
Well, thank you for this virtual town hall and the opportunity to talk directly to Arkansans about the current crisis that faces our nation and our state. And I understand how seriously the people of Arkansas take it. They are social distancing, they're following the guidelines. Sure, there are some that are acting poorly, and that's where we want them to do better, because everyone's health is at stake, and really our economy is at stake, and how quick we get out of this is at stake. And so I'm grateful for this opportunity. I think we are doing well in Arkansas in the sense of flattening the curve, in sense of reducing the growth of the cases and the hospitalizations, but it's one of those things that can jump out of control if we do not continue to do the right thing. This week, as a Surgeon General, as everyone has said, is critical, and so we want this weekend particularly for everybody really to do all they can to be careful, to social distance, wear a mask when you can't do that, social distancing, and wash your hands, and let's get through this together.
Yeah, you make a good point, and it's the holiday weekend coming up. Dr. Smith, any thoughts on that? We're in unprecedented times for sure.
This really is a historic public health emergency that's covered the entire globe. We're all in this together, though, and I think we're making a lot of sacrifices, but they're sacrifices that have really been paying off. Where we are now is very different than where we were projected to be. We are so far holding this back, although within the overall success we see many human stories, hard stories of people who have been infected or people who have had to make tremendous sacrifices to protect their families, their loved ones, their communities.
It's one of those things you got to think. We take a look at the numbers, and every one of those numbers represents a person in Arkansas and their families. I want to go ahead and start with the latest information out there. In a news conference this afternoon, Governor, there are now 1,146 cases in the state. 305 people have recovered so far. 21 Arkansans have lost their lives in this fight as it goes on. I want to give you a graph, too, of the projected versus reality, something that Dr. Smith just mentioned. You can see it right here. We're trending right now below projected numbers for 12 days in a row. So when you look at these numbers, we see a graph, Governor or Doctor. What is it that it's telling you guys about what we're doing and where we need to go? Some of the things you may have just covered.
Well, I'll start with that. And whenever you look at that graph, everybody is projecting. And you have, that was the University of Washington study that does the projection and the modeling. The White House relies upon that. It's cited very frequently, and they do it for every state. Now, what's interesting is that if you'd looked at that same model 2 weeks ago, they would have had our projections even higher. But because of our success and our trend line, they're lowering those projections. And so I'm very pleased, though, that those projections there we are beating significantly. And you also see how level the red line is. I mean, it goes up a little bit, but it's a very gradual. And if you remember what all the doctors were talking about and the health professionals were talking about is, can you flatten the curve? Can you reduce that growth line? And that's what we've been successful in doing.
And it's one of those things, and it's good to see that. It's reassuring to a lot of folks. Some things, and you've discussed this with the national media about the stay-at-home order, shelter-in-place protection, things like that. It's something that a lot of people ask us about. How come we're not under a stay-at-home order? Your argument tends to be we're probably doing better than that.
Well, we are. You know, we want to solve the problem. We want to address it based upon Dr. Smith's advice and counsel and his team at Public Health, what works for Arkansas. So we've adopted a very targeted approach, and we're asking people to make sacrifices and to do tough things, but at the same time, we don't want to do something that does not bring a benefit but cost us a lot. And so it's very important to know that if we did a shelter-at-home order today, because you exempt essential businesses, and that's defined very broadly, you would have over 700,000 Arkansans get up tomorrow morning and go to work. And so the risk is still there, and it gives them this idea, well, we've done something, we don't need to do anything more. It's better to say, let's put the mask on, let's do the social distancing, because everybody still has to go out to the grocery store. They can go out to take a walk. That is the right emphasis for us, and then we've closed our bars, the restaurants to dine-in service, gyms. All those are heartaches that we've done, but those are necessary steps that we've taken. And I want to ask if Dr. Smith can elaborate on that a little bit.
I agree, and it's really more important what we actually do rather than just what we say we're going to do. And we've taken the actions as Arkansans to limit the transmission of COVID-19. We've taken very hard actions. They've been hard on businesses. They've been hard on our school children being out of school. Well, maybe they don't think so, but it's been hard on them. These things are taking effect, but we're taking a very targeted approach. But I think our numbers are showing that we're doing well compared to the other states in our area, in our region. We have the lowest number of cases per population.
And that is comforting. At least one person has tested positive for COVID-19 in all but 8 counties in the state. The top 5, Pulaski County, as you know, 184 people have tested positive for COVID-19. Jefferson County has 82, Cleburne County 69, Crittenden 62, and Faulkner County 55. So let's talk about the way this virus spreads. It's kind of interesting as we have seen it spread throughout our state. You know, a month ago, we were just starting this with one case, and now we're looking at over 1,100 cases. So, Dr. Smith, if you can just kind of explain to Arkansans how this disease spreads from person to person.
Well, this is a respiratory virus, and the main way that it spreads is from symptomatic people, from coughing and sneezing. But we also know that it can remain on surfaces as well. So it's really important that people wash their hands. If they touch surfaces, not to touch their face. It's hard not to do since we're used to doing that. We now know that it can also be spread to some extent by people who don't yet have symptoms. And so it's important. That's why we talk about wearing masks when we're out in public. So if someone has an early infection, not even having symptoms yet, that cloth mask can help capture droplets, keep it from spreading to other people.
We're going to talk about masks in just a second, but this virus spreads a lot quicker and easier than the flu.
That certainly seems to be the case. This virus really spreads more quickly than I think anything we've ever seen. Now, influenza is amazing in its ability to spread. It goes all the way around the world every year, but it takes a whole year to do it. This virus has made it to virtually every country on Earth in a period of 3 months.
Yeah, I've seen some of the kind of like the animated displays of how this thing can travel in the grocery store, and some of them are actually pretty frightening. When we talk about masks, we've heard a lot about the N95, but then we've seen demonstrations on cloth masks to wear. Right. There are all kinds of masks out there. There are dust masks that carpenters wear. What kind of mask should we be wearing? Is it kind of like anything you can get your hands on, or there's other variations that help? And is it kind of a seatbelt type of situation? We don't get in our car and anticipate a car accident, but we put one on anyway.
I think there are a lot of different types of masks there. If you go out on the internet, you see all sorts of things people come up with. It depends on what you're using it for. For healthcare professionals who are caring for COVID-19 patients, it's absolutely essential that they keep out all the virus. And so an N95 mask that's fit tested so that it filters out all virus, that's critically important for those who are caring for sick patients. For the rest of us, we wear the cloth masks not so much to protect us from COVID-19 in the environment, but if everyone wears a mask and it captures the virus at its source, keeps it from getting out to other people.
You know, I've seen both of you in your news conference daily briefings wearing your mask. I can't help but wonder, though, when we're wearing these masks, we're protecting ourselves from COVID-19. It could get on the mask. So is there a right way or a wrong way to put it on and take it off when we touch it? Are we putting COVID-19 on our hands?
Well, again, remember the mask is primarily for source control, to keep the droplets that we produce from getting out in the environment. It doesn't take the place of the social distancing, maintaining that 6-foot distance, because that's still critical. And if we do that, we're not going to have to worry about COVID-19 being on the surface. Okay. It is advisable to wash them. They're cloth.
I was about to say, wash them. What if you have paper masks? Should you just throw those away? Should you toss them?
Those
or can you sanitize them?
It's harder to sanitize a paper mask, but that's why the cloth masks are recommended for the general public. That way we can keep the disposable personal protective equipment, PPE, for the healthcare workers who really need it.
When we talk about masks and PPE, none of this, as you know intimately, is cheap. Rather expensive. You've allocated somewhere in the neighborhood of $75 million to buy masks and other personal protective equipment. I've got a question. Roxanne from Cabot asks, does any of the PPE or ventilators from the Federal Reserve go to private nonprofits such as Baptist Health Medical Center, or are they responsible for purchasing their own, Governor?
No, they receive part of that. And so Dr. Smith, the public health team, has set priorities for the distribution of the PPE protective equipment that we get from the federal stockpile. And so that first goes to our healthcare workers in hospitals all across this state. And We have received all that we're going to get from the federal stockpile, at least that's what the indication is, and so that's why we're also out there purchasing separately protective equipment from anywhere in the globe that we can get that. We should have a shipment coming in either tomorrow or the next day that will help relieve some of that pressure. We want to be able to get that to our hospital workers across the state.
Okay. Dr. Smith, once it's been determined that a person has COVID-19, they've been tested, no question, it's time to go to the hospital. What kind of treatment will they get there?
Well, not everyone who is infected with COVID-19 will get sick enough to have to go to the hospital, and that's one thing to make clear. Many people have very mild symptoms, some have no symptoms at all. But for those who do get sick enough to have to go to the hospital, they should call ahead so that they don't come without warning, and then those who are caring for them can make sure they have proper PPE to take care of them safely.
Okay. Okay. Governor, this week you said you were sending 5 ventilators to the state of Louisiana. Very generous gesture, something that, I've always said, Arkansas is so generous, Arkansans are so generous, a very nice thing to do. But, you have to wonder, with so much talk about the value of these ventilators and the necessity to have them, how many ventilators do we have in the state, and do we have enough to actually give some of them away?
Well, it's a very good question, and I believe we have over 500 ventilators in the state, and right now we have probably less than 40 that are on ventilators as a result of COVID-19. But I look at Louisiana and Governor John Bel Edwards there and what they're struggling with, and they're our neighbors. They're our neighbor to the south. Now, we're watching them very closely. We don't want them coming into Arkansas because of the hot spot that they've really become, but we want to help our neighbors, and we can, I thought it was a pretty good example and a way to express our concern for them without jeopardizing our own stockpile.
I want to switch now to the, getting the masks on and then perhaps coming down with COVID-19. On the other side of this, once someone has contracted this and they've been treated and they recover, then there's some questions about just exactly what is recovering. This is, of course, for Dr. Smith. Ron from Conway asking this. So you've recovered from COVID-19. What does that mean? You don't have the virus? You can't spread it to someone? Or you've now developed immunity and can't get it again? A number of questions on what happens at that point.
Well, there are some questions that remain unanswered, but once someone has recovered, their symptoms have resolved, and they've been at least 7 days from the beginning of their symptoms and at least 3 days without fever, they are generally considered recovered, able to go out in public again, not a risk to others. Now, presumably they do have some immunity, but we don't know how strong that immunity is or how long it will last. These are still questions that we're trying to answer. Remember, this virus was unknown 3-4 months ago.
Yeah, a lot of unknowns still, but we're navigating the water as best we possibly can. And some unknowns that are getting hit with Governor. Economically, we're getting hit because a lot of folks are on the sidelines, a lot of businesses doing their best to prevent this. Unemployment is growing. You're expecting 150,000 additional claims by the end of the week. Food banks are struggling. They're trying to stay supplied. State government and cities essentially shutting down. It's tough survivability here for this economically. Here's another question, this one coming from Michael in Little Rock. Governor, while I understand the social distancing, how long can this last without severe consequences for Arkansans? Many are already unemployed or partially unemployed. And why not just quarantine those at risk and reopen the state? What do you have to say to Michael?
Well, if we quarantine those at risk, and of course what we're trying to do is to, we do have self-isolation in the event somebody travels and comes back to Arkansas. Whenever they test positive, they are quarantined, they're isolated. Now, I think your question goes, why doesn't everybody quarantine? Well, in theory, if we could quarantine 3 million people without movement, then obviously that's a benefit. But the fact is we can't because we wouldn't have a food supply. We wouldn't, and if you're going to have a food supply, you have to have transportation that's going to connect that. And people can't stay quarantined without movement for very long. And so that's why we look at it and say, let's do something that's effective, because we're going to have 700,000 to 1 million that are going to be moving because they're in essential services. Let's shut down what is person-to-person contact, which we've done. We've targeted those things. And then let's ask everybody when they go out, whether you're an essential business or what they describe as a non-essential business, wear a mask, protect yourself, socially distance, and that will have the same beneficial effect as if we're self-quarantining, because you're not adding to the contagion, you're not adding to the spread. And so that's working in Arkansas. And if you look at all of the Southeast Conference states, we have the lowest rate per capita of hospitalization rates of any state in the Southeast Conference. And we're not bragging on that because it could break tomorrow in a different direction. And if it breaks tomorrow in a different direction, then obviously we're going to take more stringent measures. But whenever we see that, I don't want to put another 100,000 people or more out of a job that doesn't bring a benefit to us from a health standpoint.
Just to add on that, Paul, real quick, what about, and I think he kind of alluded to this, quarantine the high-risk folks, and people at low risk can go about their business and open up some of the business around Arkansas. Is that just too risky?
Well, I mean, the high-risk people would be those with conditions, preconditions that weakens them, or those that are over 65. I actually have been thinking about whether that's an appropriate measure. The risk is that everybody else will think, well, we don't need to worry about it then because we're not at risk. And so I'd like to have Dr. Smith comment on that.
Well, I think I agree with the governor's comments. And first, I also want to really compliment you on your leadership in this. I know you didn't ever plan to be the health governor, but you have really shown incredible leadership with this. I think there are strategies for quarantining individuals, but I don't think it would be, with this virus, very practical to try and separate those at risk from those not at risk. This virus spreads so easily that potentially any of us are at risk if we've been out in public.
That's what I was thinking. We're all at risk. And yeah, there are people in the high risk category, but every single one of us is at risk. Very good conversation here, but let's cut to the chase. Every time I do a Facebook Live on this issue, people want to know, where is my money? So Wendy from Ozan, she has this question. When will we get details about whether we will get $600 per week for unemployment like the stimulus package talked about?
Well, I assume that you filed your unemployment claim, and if it's been approved, then that check should be issued by the end of next week at the latest. That's what the federal government is telling us. So you should get your unemployment check, but you also should get the $600 additional amount each week under the federal government plan. And so, that is what we've been told, and I'm passing that on to you. And I do believe that that's becoming very close to reality. So I know this is tough. That's why we're working so hard to process the 110,000 claims that have already been filed. I've got word that those have been approved, and so that money should be flowing by the end of next week.
That's good to hear. Jennifer Panatti with KNWA News in Northwest Arkansas sent a question for the region. Let's listen in.
As a home to Walmart, Tyson, and J.B. Hunt, Northwest Arkansas is a major business hub as other states hit their COVID-19 peaks before our state and possibly ease travel restrictions sooner. How does Arkansas plan to handle business travel for these large companies?
Well, that's a very good question, and of course I come from Northwest Arkansas, so I identify with the growth that's there. I understand the global travel that's such a big part of those companies' histories. And they have taken very important steps. They first stopped their global international travel. They have taken measures to work remotely within the companies. As to the future, we want them, of course, they're essential industries, and so they continue to do the work, but it's under sort of tightened constraint. So we want to be able, as soon as we can, to say this is past, they can get back to doing business as normal. They've been incredibly good partners. I'll just mention that Of course, Walmart is partnering with some high-speed lab tests for our healthcare workers, but then J.B. Hunt, when we had some protective equipment stuck in China and we couldn't get it back, J.B. Hunt had us at a high level talking to FedEx, and they partnered together to get that back for us. So those companies have really been helpful during this crisis.
And the thing, patience is a virtue with this. I mean, it seems like right now is time for everyone to dig deep and be as patient as possible as we try to get through this. Just a few weeks ago, we could go to the grocery store, get basically anything we needed, and I'm asking this question. Does the state have access to a stockpile of toilet paper? If so, how can I get access to it? And what kind of a health emergency is that? Asking for a friend, by the way.
Well, it's in a secret location that only the governor knows about.
And Lieutenant Governor is probably guarding it.
The problem is some people probably believe what I just said.
Right?
Yeah. That's right. There is no secret stockpile of toilet paper anywhere in the state.
Unfortunately.
That we know of.
Unfortunately.
Anyway, gentlemen, sit tight. We've reached out to our congressman in Washington, D.C. for their questions for Governor Hutchinson. When we come back, we're going to sample some of those, see what our friends, our representatives in Washington, D.C. are asking. Also, you've been sending us pictures from across Arkansas, folks who are riding this out together.